Apple unveils its Watch Series 4 with FDA-approved ECG. So you can find the story anywhere. I'm actually looking at the Healthcare IT News story. And, the big thing is right there in the title. FDA-approved ECG on the Apple Watch was one of the big reveals. And that's, and that's pretty exciting to have that on your wrist, and you can just touch the digital crown. You can get the ECG done. But I thought the more interesting one to me was the fall prevention work that they had done. And so the fall prevention is when it detects a fall, they can tell if you slipped, if you fell forward, because the actions are pretty standard, and the watch would sort of track that. And so if you fall, it will initiate an SOS call, and or it'll pull it up. So all you have to do is hit a button and you can actually call somebody. So the famous I've fallen and I can't get up, the Apple Watch will function as that. The second thing is if you fall and are immobile and don't move for 60 seconds, it will actually make that call that emergency contact for you. And I would assume give your GPS and those kinds of settings. So the Apple Watch is really becoming a medical device. I mean, clearly, it's FDA approved, and they are continuing to push in this direction. So I guess let's start here. So where does this fit in the strategy? Are we, let's see, are we issuing an Apple Watch to all patients of a certain acuity in the hospital, so that if they fall in the hospital, we know if they, or home care is probably a better case. Should I buy one for my parents and my father-in-law who are in their 80s, so I can have peace of mind and set me up as the emergency contact? So if they fall, and they live, my father-in-law lives on his own. So if he falls, it would be great for my wife to get a phone call and be able to help him in that time. So where does it fit? Where does it fit in the overall IT strategy and really health system strategy, do you think?
Yeah, it's a great question. And it was interesting when I saw that they'd unveiled the ability to do, the EKG or the elevated heart rate. What I love about it is I think we sometimes discount that our baby boomers and our seniors, and there's 1,000 people every day in the state of California aging into Medicare eligibility. And so that whole population is very tech savvy. So I share a plan with my mom. She's almost 76, a data plan. I had to go unlimited data. This is a woman who didn't want a smartphone. And now she's like, literally, I feel like I have a teenager for all the right reasons. I had to go on an unlimited data plan because my mom is online so much on her smartphone. She's like, wow, these apps really use a lot of data. I'm like, yes, they do. So part of that, what I think is great about what Apple's doing is that they have slowly integrated themselves into a population that was historically seen as being maybe scared of technology or not as much of an adopter. And now it's not a big deal. I could give my mother an Apple Watch and I'd probably, thank goodness I already have unlimited data. It's one of those things that it would be one more thing in her technical ecosystem. And she has Alexa and she helps her out with all kinds of different things that she's looking to do. So I remember last year at HIMSS, the day before HIMSS, we always have the Big Chime conference. And one of our first speakers talked about the fact that hospital systems that are early adopters of taking high-risk patients, like somebody who has CHF and or COPD, a pretty common combo of being a high likelihood for readmission, sending that patient home with an iWatch to look for elevated heart rate and to look for just different anomalies that may be occurring, to provide that intervention ahead of time and call them and potentially prevent them from having to go to the ER and be able to get in front of those types of things. We are at the precipice of this, and it'll be some of the larger health systems that maybe take this on initially, but it's the beginning of being able to say, if I'm wearing an iWatch and it starts to track my body temperature, and for 2 or 3 days I've had a fluctuation in body temperature and a fluctuation in my heart rate that I wasn't anticipating or I wasn't even paying attention to, it's actually the sign of like a pending infection, then my watch is going to tell me ahead of time that even I may have something going on. So right now it's maybe high-risk patients and that are at risk of being readmitted. But at the end of the day, it's going to be people that are in their 40s like me who maybe have something going on that we weren't even aware of because it's not happening at a very acute level.
Yeah, John Halopka and I last week talked about the role of incentives and how 80% of their patients now at Beth Israel Deaconess are at risk. So they're not at risk health, but the health system has taken risk in terms of the contract to manage that patient. So they're only getting a fixed amount of money to manage those patients. And that really changes the paradigm. So, giving somebody a $300 watch to go home with might make sense if you have a risk-based contract and you need to monitor those things. If we're still in a fee-for-service model, you're maybe not looking at these kinds of alternative models. But if it matters to you what's happening at the home, I understand it matters to everybody from an altruistic standpoint, but if it matters from a financial standpoint, then you're saying, hey, this $300 investment makes sense to manage, to make sure that we're monitoring this person on a 7/24 basis, so that they don't become to a higher acuity and higher level of need.